The gentleman from California is recognized for 5 minutes.
About one of the slides you shared with me, and it was a bell curve that showed what would happen across the United States as far as the spread of this disease if mitigation efforts were not taken by the American public and in your agencies, versus mitigation efforts to basically flatten that bell curve. And I think the primary purpose of that is so that our healthcare facilities and physicians, as well as the supplies, are not, for lack of a better term, overrun by a steep bell curve. Am I correct in making that statement?
Yes, sir.
And I think another way to say it, too, it's not a question of if, it's a question of when the virus continues to spread across the United States, but we want to pace it out as long as possible. Is that a correct statement as well?
Yes, sir.
Thank you. One of the issues, too, in helping address this is the fact that we do not have enough test kits. We know that many individuals, as the my fellow member to the right of me, Mr. Raskin, pointed out, there are individuals who have requested test kits and have not been able to access them. My understanding is as late as last Saturday, ground zero in King County, Washington, that the healthcare professionals from that facility still did not have access to test kits. And without test kits, is it possible that those that have been susceptible to influenza might have been miscategorized as to what they actually had, that it's quite possible that they actually had COVID-19?
The standard practice is the first thing you do is test for influenza. So if they had influenza, they would be positive for influenza.
But only if they were tested. So if they weren't tested, we don't know what they had.
Correct.
Okay. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States to date.
Thank you.